So, good day. My name is Richelle Nueva Mahinay from BSN Tomarsor, and today I will be performing the skin application. So, what is skin application? Definition: drug is applied directly to a body site. For assessment, observe for open lesions, rashes, or areas of erythema on skin breakdown. Assess the patient for any allergies. Verify patient name, dose, route, and time of administration. Assess the patient knowledge of medication and procedure. If the medication affects the patient vital signs, assist them before administrations. For objectives to promote absorption of medication more rapidly through use of certain topical medication. 2. To treat skin disorder and lesions caused by burns or abnormal growth. To dilute effects of a drug, local action may be less than systemic. To apply an agent that stops or prevents the growth of microorganisms. To provide a local anesthetic to specified parts of the body. For general considerations, number 1, be sure the skin is dry and clean before applying anything on it. Most often, previous preparation are removed before applying additional medication, except in the case of lotion used for soothing the skin. Also, clean the skin with soap and water before administering a preparation to the skin. The techniques remove substances from the skin that will delay absorption of the drug. And apply local heat to the area when it's indicated. This measure promotes absorption by improving blood circulation to the area. 1. Gather equipment. Check medication order against the original physician order according to agency policy. Clarify and inconsistencies. Check the patient's chart for allergies. Additionally, this comparison helps to identify errors that may have occurred when orders were transcribed the physician's order in the legal record of medication order for each agency. 2. Know the actions, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. Rationally, this knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and also can be used to educate the patients about the medication. Hand hygiene deters the spread of microorganisms. 3. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Rationally, organization facilitates error-free administration and saves time. 4. Transport medication to the patient bedside carefully and keep the medication in sight at all times. Rationally, careful handling and close observation prevent accidental or deliberate disarrangement of medication. 5th, identify the patient by checking the name on identification and then patient identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent error. Explain procedure to the patient to gain cooperation. Clean skin surface with soap and water unless contraindicated with patient condition. Dry thoroughly. To remove old ointment and replace. Squeeze medication from a tube or using a tongue blade. Take ointment out of tube or jar. Spread a small, smooth, thin quantity of medication even over patient's skin surface using your finger or a tongue blade to provide an occlusive effect. Protect skin surface with a dressing if needed so that medication cannot rub off. Assist the patient to a comfortable position. This ensures patient comfort. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effects from the medication or procedure. Lastly, perform hand hygiene. Hand hygiene deters the spread of microorganisms.